Good day everyone. Good day sir. We are the Group B of BSTM 1B, discussing about gene therapy. First of all, I will read you about the objectives of this research. To define what is gene therapy, discussing what are the pros and cons, the advantages and disadvantages. To know and understand the benefits or harmful effects of applying gene therapy to a person with diseases. So what is gene therapy? Gene therapy is a technique designed to introduce genetic material into cells to compensate for abnormal genes or to make a beneficial protein. To deliver the gene into the cells, a carrier, also called a vector, is used. Adeno-associated viruses gene into the cells are very suited as vector, as they are derived from viruses that have the natural ability to deliver genetic material when infecting cells. For their application in gene therapy, the viruses are modified to deliver good genes into the cells. AAV is a small virus that is not associated to causing disease in the first place, significantly reducing the chance of a negative reaction to the vector. By now, considerable experience has been built up with AAV for multiple applications in humans. AAV are thus an efficient and relatively safe way to bring genes into cells. Unlike other vectors, AAV introduces the DNA into the nucleus of the cell, but the DNA is not integrated into the cell's own genetic material. This makes these AAV vectors very suited for use in non-dividing cells like neurons. The new gene delivered by the vector is used by the host cell as template to produce the protein of interest, such as, for instance, a therapeutic antibody.
We used to think that our fate was in our stars. But now, we know that in large measure, our fate is in our genes, quotes James Watson. This fate that Watson's talking about is contained in our genes and deals with a new technique. Gene therapy is revolutionizing the world of medicine. Many physicians are predicting that in 20 years, gene therapy may change the practice of medicine from a treatment-based to a prevention-based therapy. May change the practice of medicine from treatment-based to a prevention-based practice. Our future is locked away inside of our genes. Gene therapy is unlocking these doors. Researchers are starting to move away from developing new drugs and towards finding an ultimate solution. That solution is to use gene therapy as a treatment for many genetic diseases. Researchers hope that in the coming years, every genetic disease will have gene therapy as its treatment. Gene therapy could be the last therapy that the human race will ever need. What is gene therapy? So, what is the mystical new wonder called gene therapy? Gene therapy is the introduction of genes into existing cells to prevent or cure a wide range of diseases. For example, suppose a brain tumor is forming by rapidly dividing cancer cells. The reasons this tumor is forming is due to some defective or mutated gene. The therapy chosen for this case would be to use a herpes virus that has had its virulence removed, rendering it harmless. The virus is still able to insert its genetic material into the target cells. The virus is then taken and injected into mouse cells where it makes additional copies of itself. These mouse cells, now containing the virus, are then injected into the brain. Once inside the brain, The virus seeks out the target tumor cells and invades them. The tumors will now start to produce herpes enzymes because the virus has inserted its genetic material into the tumor cells. Now, a physician can treat the patient with the herpes curing drug that will destroy the tumor cells along with the mouse cells that are producing the herpes enzyme. The other target of some of the retroviruses used include bone marrow, skin, and liver cells. Genetic alteration of bone marrow cells aims to correct the mutated part of the cell or its progeny. Skin cells work in a different manner. Geneticists found that cells synthesize and secrete proteins, but these are transported through the blood to be utilized by other cells. Researchers are trying to use skin cells to synthesize an enzyme that it does not normally make. They then hope that it will take that enzyme to some other cell. That cell may not be able to make the enzyme, but the skin cell transports an essential enzyme that will help that new cell functions properly. Research with liver cells is still in the beginning stages.
Two types of gene therapy. The two forms of gene therapy are somatic gene therapy, which involves introducing a good gene into targeted cells to treat a patient, but not the patient's future children because these genes do not get passed along to offspring. In other words, even though some of the patient's genes may be altered to treat a disease, it would change the chance that the disease will be passed on the patient's children. This is the more common form of gene therapy being done.
Germline gene therapy, which involves modifying the genes in eggs or sperm cells, which will then pass in any genetic change to future generations. Experimenting with this type of therapy, scientists injected fragments of DNA into fertilized mouse eggs. The mice grow into adults and their offspring had new genes. Scientists found that certain growth that fertility problems could be corrected with this therapy, which led them to think that the same could be true for humans, although this potential for preventing inherited disease. Germline gene therapy is controversial and very little research is being done for technical and ethical reasons.
What you can expect. Currently, the only way for you to receive gene therapy is to participate in a clinical trial. Clinical trials are research studies that help doctors determine whether a gene therapy approach is safe for people. They also help doctors. So, di ka makadali-dali o makareceive o gene therapy unless di ka mukuhaan silang activity. It's like in a clinical trial. So, kailangan ma-participate ka para po makatabang ni sa doctors na okay ba imuhang kanang lawas o kanan o gene therapy. Understand the effect of gene therapy on the body. Your specific procedure will depend on the disease you have and the type of gene therapy being used. For example, in a one type of gene therapy, you may have blood drawn or you may need bone marrow removed from your hip bone with a large needle. Then, in the lab cells from the blood of the bone marrow are exposed to a virus or another type of vector that contains the desired genetic material. Once the vector has entered the cells in the lab, those cells are injected back into your body, into a vein or into tissue, where your cells take up the vector along with the altered genes. Viruses are not the only vectors that can be used to carry altered genes into your body cells. Other vectors being studied in clinical trials include stem cells. Stem cells are the cells from which all other cells in your body are created. For gene therapy, stem cells can be trained in a lab to become cells that can help fight disease. So, stem cells is makatabang ni siya to fight sa imuhang disease nga mas better ang imuhang kana ang lawas or mas better nga na ang stem cells or naman dyan kaniyang stem cells to fight sa imuhang disease. Liposomes. These fatty particles have the ability to carry the therapeutic genes to the target cells and deposit the genes into your cell's DNA.
Results, the possibilities of gene therapy hold much promise. Clinical trials of gene therapy in people have shown some success in treating certain diseases such as severe combined immune deficiency is a very rare genetic disorder that causes life-threatening problems with the immune system. It is a type of primary immune deficiency. Hemophilia is a rare disorder in which your blood doesn't clot normally because it lacks sufficient blood clotting proteins. If you have hemophilia, you may bleed for a longer time after an injury than you would if your blood clotted normally. Number 3. Blindness caused by retinitis pigmentosa is a group of inherited disorders characterized by a progressive peripheral vision loss and night vision difficulties or nyctalopia that can lead to central vision loss. Number 4. Leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Many types of leukemia exist. Some forms of leukemia are more common in children. Other forms of leukemia occur mostly in adults. Leukemia usually involves the white blood cells, but several significant barriers stand in the way of gene therapy becoming a reliable form of treatment, including finding a reliable way to get genetic material into cells. Number 2. Targeting the correct cells. Number 3. Reducing the risk of side effects. So gene therapy continues to be a very important and active area of research aimed at developing new, effective treatments for a variety of diseases.
Advantages of gene therapy. Gene therapy replaces a faulty gene or adds a new gene in an attempt to cure disease or improve your body's ability to fight disease. Gene therapy holds promise for treating a wide range of diseases such as cancer, cystic fibrosis, heart disease, diabetes, hemophilia, and AIDS. Gene therapy is used to correct defective genes in order to cure a disease or help your body better fight disease. Researchers are investigating several ways to do this, including advantages of gene therapy. The advantages of gene therapy far outweigh the disadvantages. The advantages of the technique is to give someone that is born with a genetic disease or who develops cancer the chance at a normal life. I think this is an advantage that far outweighs any of the disadvantages that have been presented against gene therapy. Giving someone a chance at a normal life should be enough for many of the people that oppose this technique to change their minds. I believe the reasons that these people are opposed to gene therapy is because they see it as something foreign and scary. The reason people are scared is because they do not understand the techniques. I think if scientists educate our society, many people will change their minds. I believe that if the people that oppose these techniques were ever faced with a cancer or a child born with a genetic diseases, they will change their views. These skeptics would choose gene therapy, especially if it would save a loved one's life. In a coming future, gene therapy will play an important part in many people's lives. Gene therapy is an exciting new approach that is just making the news. In the future, this technique will be an everyday word used in our households. Gene therapy will change the fields of medicine from what it is today. As scientists discover more genes and their functions, the potential of this treatment is limitless. Our genome is the blueprint of our body. The key to our future is locked in our genome. As researchers start to understand this blueprint, our lives will be forever changed. We now know our fate is ended in our genes.
As we can see, gene therapy has a lot of benefits and advantages. Just like the disadvantages, gene therapy is an experimental technique in medical science that uses gene to either prevent or treat disease. The goal with this approach is to create a future world where doctors could treat specific disorders by inserting genes in a patient's cells instead of using surgery, drugs, or other interventions to improve health. There are several different approaches to gene therapy being researched today. One method involves the replacement of a muted gene with a healthy copy of it. There is the possibility that a muted gene could be inactivated so that its improper functionality stops. Doctors could even introduce new genetic materials into a patient's body to help them fight a disease. When doctors can replace or deactivate faulty cells that lead to detrimental conditions, then the individuals and their families can find. Replacing muted genes, some cells become diseased because certain genes work incorrectly or no longer work at all. Replacing the defective genes may help treat certain diseases. For instance, a gene called P53 normally prevents tumor growth. Several types of cancer have been linked to problems with the P53 gene. If doctors could replace defective P53 gene, that might trigger the cancer cells to die. Fixing muted genes that cause disease could be turned off so that they no longer promote disease, or healthy genes that help prevent disease could be turned on so that they could inhibit the disease, making disease cells more evident to the immune system. In some cases, your immune system doesn't attack disease cells because it doesn't recognize them as intruders. Doctors could use gene therapy to train your immune system to recognize the cells that are treated. It can work in combination with cell therapy techniques. Gene therapy involves the transfer of genetic materials. Cell therapy is the process of transferring cells with relevant functions into the patients when the genetic material is missing in the first place. Some protocols utilize both, which can give patients a powerful way to recover from their medical condition. Stem cells can be isolated from a patient and then genetically modified in tissue culture to start the expression of a new gene. Once the treatment expands to suitable numbers, then the patients receive the therapy as part of their overall care.
One cancer. A variety of efforts are underway to use gene therapy to treat cancer. Some types of gene therapy aim to boost the body's immune cells to attack cancer cells, while others are designed to attack the cancer cells directly. One way the body protects itself from cancer is to cells are main components of immune system, but some cancers are good at avoiding this protection mechanism, says Casper. Chimeric antigen receptor or CRT cell therapy is a new form of immunotherapy that uses specifically altered T cells to more specifically target cancer cells. Some of the patient's T cells are collected from their blood, then genetically modified to produce special CR proteins on the surface. When these CRT cells are infused into the patient, the new receptors that help the T cells identify and attack cancer cells specifically and kill them. Application: inserting gene into cancer cells to make them more sensitive to chemotherapy, radiation therapy, or other treatments. Removing healthy blood-forming stem cells from the body, inserting a gene that makes these cells more resistant to the side effects of high doses of anti-cancer drugs, and injecting the cells back into the patient. Introducing suicide genes into patients' cancer cells, giving a prodrug and inactive form of toxic drug. Activating cancer cells containing these social genes will produce to destroy cancer cells, preventing cancer cells from developing new blood vessels or angiogenesis.
Vision. There are more than 250 genetic mutations that can lead to a type of blindness called inherited relaxed retinal diseases, or IRD. People with a defect in the RPE65 gene start losing their vision in childhood. As the disease progresses, patients experience gradual loss of peripheral and central vision, which can eventually lead to blindness.
3. Movement. For children with a genetic disorder spinal muscular atrophy or SMA, a rare muscular dystrophy, motor nerve cells in the spinal cord are damaged, causing patients to lose muscle strength and the ability to walk, eat, or even breathe, says Gaspar. SMA is caused by a mutation in gene called SMN, which is critical to the function of the nerve that control muscles movement. Without this gene, those nerve cells can't properly function and eventually die, leading to debilitating and often fatal muscle weakness. Researchers recently developed the first US-approved gene therapy to treat children less than 2 years of age with SMA. The therapy is designed to target the cause of SMA by replacing the missing or non-working gene with a new, working copy of a human's SMN gene, helping motor neuron cells work properly. Four, infectious diseases. Researchers believe targeted gene therapy and gene editing may have widespread application for a range of infectious diseases that aren't amenable to standard clinical management, including HIV. Although HIV is not a hereditary disease, the virus does live and replicate in DNA, Gaspar explains. Another early but encouraging approach uses a gene editing technology combined with a new long-acting antiretroviral treatment to suppress HIV replication and eliminate HIV from cells and organs of infected animals. Gene editing is an approach that precisely and efficiently modifies the DNA within a cell. In this approach, gene editing can knock out a receptor called CCR5 on immune cells used by HIV to enter and invade cells. Without CCR5, HIV may no longer invade and cause disease.
5 rare diseases. One approach being investigated for a number of rare, often fatal diseases uses gene-modified blood stem cells with the goal of permanently correcting the underlying cause of disease. Blood stem cells are taken from the patient and corrected outside the body by introducing a working copy of the gene into the cells. The gene-corrected cells are then put back into the patient to potentially cure the disease. Gene-modified blood stem cells have the capacity to self-renew and once taken up in the bone marrow, can potentially provide a lifelong supply of corrected cells. Because of their ability to become many different types of cells in the body, this approach has the potential to provide a lasting treatment for many different severe and often life-limiting inherited disorders, many of which have no approved treatment options available, says Casper.
Disadvantages. Gene therapy does not have a reliable delivery method. Retrovirus delivery systems are the most common way for gene therapy to be delivered to patients. The problem with these options is that the enzyme used to encourage the transfer of genetic data can be eliminated by the immune system before it has the chance to work. There could be issues with cells divisions or replications that limit the effectiveness of the treatment. When there is noticeable change to cells, the body might attack itself without the presence of an immunosuppressant. Until we can remove and replace genetic data with more reliability. The success story for gene therapy will always be hit or miss.
Gene therapy is an expensive procedure. There are several gene therapy options which are available right now, but they come to a step price. If you use Luxturna to treat both eyes as a way to treat blindness, then the final cost could be more than $1 million. Even the affordable options in this field start at $200,000 per treatment. That is why many patients wait for clinical trials to begin and then apply for a spot in one to receive and help they need. Most healthcare insurance plans will not cover the cost of these procedures because of their uncertainty. So, daghang tao ang maka-afford o magpakuan og gene therapy. Usually mga dato, but if kita ang tao maka-afford da if tabang sa gobyerno or mukantang mga financials para lang makuan nato ang makuan if na ever na ay sakit imong kuan like tumor sa imong pamilya, so makuan na sila.
Three, gene therapy requires ongoing treatments to be effective. Many people have found out the benefits of their gene therapy treatments began to wear off as soon as they were no longer taking their medicine or visiting their doctor for treatments. It can be a long life course that someone must follow to reduce or eliminate the genetic issues that hold back their health. Unless you can keep taking the products, which are often priced above $100,000 per treatment, then you will experience a reversal in your condition. Four, gene therapy may not be able to adapt to a changing world. It has taken less than a century for prescription-grade antibiotics to no longer be as effective for the treatment of bacterial infections as it once was. Antibiotic resistance can impact anyone at any age and in any country. Sometimes it occurs naturally, but the most common reasons for this issue is that antibiotic misuse has led to a growing number of infections, including pneumonia, tuberculosis, and salmonellosis, being more challenging to treat because the medicine is not as effective against the bacteria.
Five, risk. Gene therapy has some potential risk. A gene can't easily be inserted directly into your cells. Rather, it usually has to be delivered using a carrier called a vector. The most common gene therapy vectors are viruses because they can recognize certain cells and carry genetic materials into the cell's genes. Researchers remove the original disease-causing genes from the viruses, replacing them with the genes needed to stop disease.
This technique presents the following risk. Unwanted immune system reaction. Your body immune system may see the newly introduced viruses as intruders and attack them. This may cause inflammation and severe cases organ failure. Targeting the wrong cells. Because viruses can affect more than one type of cells, it is possible that altered viruses may affect additional cells, not just the targeted cells containing mutated genes. If this happens, healthy cells may be damaged, causing other illness or diseases such as cancer. Just like sa ako ang igagaw nga kana akong share nga na siya tumor, then napakon siya gene therapy sa doktor, then ayun ang doktor nga ug makuha na siya ato is mas okay na yung lawas, but giuli siya mga 3 days after ato pag humagkuan sa doktor pag opera, then sad to say in the 3 days is wa siya kagwanta, then namatay. Infection caused by the virus. It is possible that once introduced into the body, the viruses may recover their original ability to cause disease. Possibility of causing a tumor. If the new genes get inserted in the wrong spot in your DNA, there is chance that inserting might lead to tumor formations. Gene therapy does not have as a limitation. The viruses and other agents used to deliver the good. Genes can affect more than cells for which they intended. If a gene is added DNA, it could be put in the wrong place, which could potentially cause cancer or other damage.
Gene therapy does have risks and limitations. The viruses and other agents used to deliver the good genes can affect more than the cells for which they're intended. If a gene is added to DNA, it could be put in the wrong place, which could potentially cause cancer or other damage. Students' understanding. In my own understanding, bottom line on the affirmative side of gene therapy is prevent or cure illnesses. The negative side is because of gene therapy, there might be a chance that the viruses have adapted the environment or the new components of the body, and more you evolve the viruses into diseases that are no longer curable by the time. There are also bad side effects since new cells are added. The old cells will need to create something like a protection of the new substance added to the human body, which may lead to fever or other side effects. Cheap vaccine which contains similar virus which has lesser effect, like the COVID vaccine, it contains similar type of virus with less effect than the original, which can trigger the normal guards in our body to fight the virus. Because your body reacts to the substance that enters the body, it has side effects. Also, since stem cells are from something that is still alive, time will come that there will be scarcity that will occur to stem cells. When time comes that it will be popular. More people want to have gene therapy, more demand in supply, and since supply is limited, there will definitely be scarcity.
In my own understanding about gene therapy is the introductions of genes into existing cells to prevent or cure a wide range of diseases. Gene therapy is an exciting new approach that is just making the news. In the future, technique will be an everyday word used in our household. Gene therapy will change the field of medicine from what it is today. As scientists discover more genes and their functions, the potentials of this treatment is limitless. Our genome is the blueprint of our body. The key to our future is locked in our genome. As our researchers start to understand this blueprint, our lives will be forever changed. We know now our fate is indeed in our genes.
In my own understanding, gene therapy is a treatment that uses gene transfer of genetic material into the cells of a patient to cure the diseases. However, gene therapy is not required to use at all because of the risk that may happen to a patient. Gene therapy will target a wrong cells that may cause into a cancer or organ failure that leads to lost life of our loved ones.
In my own understanding, gene therapy is crucial in helping treat the disease. The gene therapy is the introduction of genes into existing cells to prevent or cure in a wide range of diseases. Example, suppose a brain tumor is forming by rapidly dividing cancer cells. The reason its tumor is forming is due to some defective or mutated genes. So, ang gene therapy is makatabang ni siya sa ato if ever natin nakasakit. But in gene therapy is not siya advantages, but it also have the advantages na nabag niya.
For me, gene therapy gives hope for the person who has illness or disease like in complication about their blood. This treatment is one of the way to boost their immune system in their body to fight for and be healthy in everyday living. It has potential to eliminate and prevent hereditary diseases such as cystic fibrosis and a possible cure for heart diseases, AIDS and cancer. Overall, I think this is gene therapy is useful and good to everyone, to those people who suffered from diseases and who wants to live a normal life.